Hello, my name is Dr. Michael Mack. I'm one of the residents here in the University of Calgary, here to explain to you VRTC Retinal Detachment Training Level 1. In this particular level, your job is to repair the retinal detachment. You start off by injecting a bit of PFO to the level of the retinal hole. So here I am, the retinal break. So here I'm just zooming out a little bit, getting more centered, and then you see that retinal tear there. So in the first level, there's only one retinal tear. You don't have to go hunting for breaks. They're just trying to get you more comfortable on where and how you should be placing the PFO and also using your cutter as well. So they like to ask you to remove the attached retina that has traction on it. So you're going to use your cutter with a high cut rate and relatively low aspiration just to remove that flap tear and cut alongside the areas around it, just so that you can remove the traction. To be honest, in Calgary, when we were watching some of the retina surgeons operate, we don't routinely do this, so this was a bit of a new experience for me. You do have to be mindful not to cut too much of the retina, and also I find that the inferior aspect is very difficult to cut unless you turn your cutter around. So then you fill the eye with PFO. You're going to switch to a curvilinear laser, and then you're going to laser around the area of the tear. You want to avoid blood vessels as usual. That will dock you points in the simulation. And because the view is so poor under the PFO, sometimes a little bit more magnification can help. Here I'm just being very cautious about the retinal vessels and also about my energy. If you use excessive energy, then the simulator will also dock you points. Overall, I think this is a very tough level. I really hope that this video helps people to get a little bit better in achieving a good score. There are a lot of nuances that you have to use some trial and repetition in order to be able to effectively complete the level. So there's a nice mark there. Now we're draining the fluid from the retinal detachment and also draining the PFO as well. So in this particular case, because the laser barricade worked well, none of the fluid actually went underneath the retinal hole, and then we induced the retinal detachment. But if you fail to have a good laser barricade, what will happen is that the retina will just simply redetach. You do want to just roll the eye a little bit in order to get the remaining PFO out. There isn't a flute option in this case. You're really just using the retractor. Here I'm doing the rest of the fluid air exchange, and I'm putting in gas in this eye. And that's the end of the level. Now let's take a look at that one more time. Again, putting in the PFO, being mindful of the posterior capsule. There's a little bit of change in the lens there. And then you want to just cut the edge of the retinal tear, and cut the flap off. And then you want to turn your cutter around and then really just enlarge in that hole a little bit. Now here's a tricky part, and I'm still having trouble with this aspect of the level. You want to be able to use your PFO and just fill it, the eye up. You want to roll the eye around, and then just use your laser and demarcate the tear. You also don't want to put laser inside the area where it's mostly just choroid, but it's just very hard to tell what that difference is and where your tear begins. So sometimes what you can do is you can actually laser the retina a little bit to give you a little bit more of a sense of where your tear begins and ends, and that way you're able to perform more efficient laser barricade under full PFO. So a few more laser spots. Now I'm draining the fluid from the area of the tear, draining the rest of the PFO. The retina looks attached, and then I'm just rolling the eye a little bit. And it looks pretty good. Next thing is just doing the fluid air exchange. You look at the pulsations of the central retinal artery. You want to make sure that your pressure is normal. The machine will give you a warning if you are injecting too quickly. So we scored 95% of both attempts. Please like and subscribe for more, and thank you for watching.